Welcome to our presentation on combining Medicare with your Blue Cross and Blue Shield Service Benefit Plan, also known as the Federal Employee Program, or simply FEP, coverage. During this presentation, we'll give you an overview of how our plan and Medicare work together, and how you can save overall by making the right choices with your health care coverage. Before we talk about Medicare, we want you to know that you're in good hands with FEP. We've been proud to offer coverage to federal employees and retirees for over 60 years. Let's start with why you should consider combining your FEP coverage with Medicare. Did you know that the Blue Cross and Blue Shield Federal Employee Program is the #1 choice for federal employees and retirees in the Federal Employees Health Benefits Program? In fact, once people choose us, over 99% of them stay with FEP year after year. Why do federal employees and retirees choose FEP? We offer a lot of benefits that you can depend on. First, we have 3 benefit plans designed for every need and budget. Second, our network has 96% of hospitals, 95% of doctors, and over 55,000 retail pharmacies in the U.S. Plus, we cover members living or traveling overseas. You also never need a referral to receive care. And most importantly, we're committed to your overall health and wellness. So, where does Medicare come in? We're going to show you why combining is the right choice once Medicare Part A and B becomes your primary coverage. Primary means that Medicare will pay its portion of your benefits first, and then we'll pay our portion second. Remember, the choice to combine your coverage is up to you. You should consider your, and any dependents, needs before choosing your health coverage. With Medicare Part A and B as your primary coverage, FEP eliminates your out-of-pocket costs for covered medical services. That means you pay nothing for doctor's visits, hospital visits, telehealth consultations, urgent care, FEP's deductibles, Medicare deductibles, and so much more. It's not just about paying less for the care you need, FEP covers you for things Medicare doesn't. For most FEP plans, that includes acupuncture, overseas care, preventive dental care, hearing aids, and more. What's more, basic option members can get reimbursed up to $800 for Medicare Part B premiums through the Medicare Reimbursement account. We'll go over this later in this presentation. You still pay your pharmacy cost shares if you combine your coverage. However, basic and standard option members get reduced co-pays for certain prescription drugs. It's a good idea to check our approved drug lists, or formularies, before choosing your plan to ensure your drug is covered. As you can see, the savings really add up when combining your Medicare and FEP coverage. Now, let's talk about choosing the right FEP coverage for your needs. Before you start looking at Medicare and your coverage options, there are some things you should think about. First, you must have 5 continuous years of coverage in the Federal Employees Health Benefits, or FEHB, program to retire with your medical plan benefits. Second, our health needs tend to change as we age. If you're healthy now, you may have greater health needs later. Third, OPM continues to pay a portion of your FEP premium once you retire. Fourth, once you retire, we keep you in the same insurance group as actively working employees. And finally, if you cancel your FEHB coverage while retired, you can never re-enroll. It's also important to consider the needs of dependents, such as a child under 26 or a spouse. You want to keep their needs in mind when selecting a health plan since Medicare only provides individual coverage. FEP provides coverage for your eligible family members. And if you pass away, your dependents will be able to keep their coverage. Now that you have those things in mind, let's review FEP's 3 plan options. There's FEP Blue Focus, Basic Option, and Standard Option. Since all of our plans provide excellent coverage, you may be wondering how to narrow down the right one for you. Keep in mind that if you start in one plan now and your needs change in a few years, you'll have the opportunity to switch plans annually during open season. Let's take a closer look at each of the 3 plan options. First, there's FEP Blue Focus. It's well suited for those who don't use their health care benefits very often, only use in-network providers, and don't have many prescription drug needs. Under this plan, you pay the lowest FEP premium. When you combine it with original Medicare, we pay your deductible, so it becomes a deductible-free plan. Note that it has our most limited drug formulary and does not cover benefits, such as hearing aids and preventive dental care. Then, there's Basic Option, which has been the plan most federal employees choose in the FEHB for over 15 years. As we mentioned earlier, you get up to $800 back for paying your Medicare Part B premiums when you combine basic option with Medicare Parts A and B. Unlike FEP Blue Focus, you get added coverage for things Medicare alone doesn't cover, like hearing aids and preventive dental care. We also enhance your prescription drug coverage with lower-cost generics and access to the mail service pharmacy. With basic option, you must see a network or preferred providers to get care. Standard option is our third plan, and it's the only one that allows you to go in and out of network for non-emergency care. It has the largest approved drug list or formulary. This makes it a good option for members who have complex prescription needs. When you combine it with original Medicare, we pay your deductible, so it becomes a deductible-free plan. You also get added coverage for things Medicare alone doesn't cover, like hearing aids and preventive dental care. However, you pay the highest FEP premium for standard option. Here are the 2023 monthly premiums for each FEP plan. When you're retired, you pay your premium monthly instead of biweekly. The premium is usually deducted from your monthly annuity. If you wish to change your FEHB coverage, you can do so during the annual federal benefits open season. That means if you want to try FEP Blue Focus 1 year, you could switch to basic option in another year. Open season is the second Monday of November through the second Monday of December each year. As we mentioned earlier, if you cancel your FEHB coverage completely, you can never re-enroll. If you want to try a non-FEHB plan, such as Medicare Advantage or TRICARE, we recommend suspending your coverage instead of canceling it. You can only suspend your coverage as a retired employee. You can learn more about your health plan options in retirement at opm.gov/retire. Next, let's review the basics of Medicare. Medicare is a health insurance program provided by the federal government. It's available to individuals who are 65 and older, individuals under 65 with certain disabilities, individuals with end-stage renal disease and individuals with ALS, or Lou Gehrig's disease. You might have heard Medicare is made up of different parts. Do you know how many parts it's made up of? Is it A, 3 parts, B, 5 parts, C, 2 parts, or D, 4 parts? The answer is D, 4 parts. Each part offers different areas of coverage. We'll go through them together. Medicare Part A is hospital insurance. It covers inpatient care, home health care, and hospice care. Part A is free for people who are 65 and older and eligible for Social Security. Most federal employees take this as soon as they are eligible because there usually isn't a premium. Medicare Part B is medical insurance. It covers outpatient care, doctor's visits, durable medical equipment, and more. The standard premium varies each year, and what you ultimately pay is based on your income. You might hear the term Original Medicare when researching Medicare. That simply refers to Medicare Part A and Part B together. Medicare Part D is prescription drug coverage. This covers prescriptions, which are not included in Medicare Part A and Part B. Part D's benefits and premiums vary based on the plan you choose. When you keep your FEP coverage, you do not need Medicare Part D. FEP coverage includes prescription benefits comparable to those offered through Part D plans. This is known as creditable coverage. But what about Medicare Part C? This is often called Medicare Advantage or an MA plan. Medicare Advantage is offered by private health insurance companies. The plans bundle Medicare Part A and B benefits together, and many also include Medicare Part D benefits. Depending on the plan you choose, its benefits and premiums vary. Let's talk more in depth about the costs of Medicare. For most people, Part A is free as long as you've paid enough in Medicare taxes. For most people, that means you've worked at least 10 years. Even though most people don't pay a premium for Part A, you'll have an annual inpatient hospital deductible to meet before Medicare will begin paying its portion for inpatient services. For inpatient hospital visits, you pay a $1,600 deductible under Medicare Part A. But with FEP and Medicare Part A, we pay your deductible. Let's take a close look at the costs of inpatient hospital care with only Medicare Part A once you meet your Medicare Part A deductible. Medicare covers up to 90 days of inpatient hospital care annually, with the first 60 days covered in full. You pay a per-day cost share for days 61 to 90. If you have a medical event where you need more than 90 days of hospital care, Medicare has lifetime reserve days which you pay per day for. You get 60 days to use per your lifetime. After 90 days, you'll be responsible for paying all the costs. Now, let's compare that coverage to when you combine Medicare and FEP. You pay nothing out of pocket for your 90 days of coverage and 60 lifetime reserve days. After you use up your lifetime reserve days, you're only responsible for paying FEP's regular inpatient cost shares. Let's look at the costs of Medicare Part B. What you pay for your Medicare Part B premium depends on your income. The standard monthly premium in 2023 is $164.90. Note that if you're above a certain income level, you'll pay an income-related monthly adjustment amount, or IRMA. Your IRMA is a cost that's added to your monthly Medicare Part B and, if applicable, Part D premiums based on your annual income. The amount you need to pay is determined by the Social Security Administration. You can see the current IRMA amounts at Medicare.gov. If you have Medicare Part B without FEP, you must pay an annual deductible before Medicare will begin paying for services covered by Part B. When you combine your coverage with FEP, we pay your Medicare Part B deductible. Once you meet your deductible, you have a 20% coinsurance for Medicare Part B covered services. However, when you combine FEP and Medicare, you don't pay the coinsurance. Now we'll go over how certain FEP members can get reimbursed for Medicare premiums through the Medicare Reimbursement account. But first, do you remember which parts of Medicare are called Original Medicare? Is it Part A and Part B? Part C and Part D? Part B and Part D? Or Part B and Part C? The answer is A, Part A and Part B. Basic option members who have Original Medicare have access to the Medicare Reimbursement account. So, what is the Medicare Reimbursement account? With this benefit, basic option members who have Medicare Part A and Part B can earn up to $800 as a Medicare Part B premium reimbursement. If your spouse also has Medicare, they can receive this benefit too, making the reimbursement $1,600. You can use this benefit even if Medicare isn't your primary coverage. Here's how you can get reimbursed. First, register or log into your account online at fepblue.org/MRA or by calling 1-888-706-2583. Second, submit your claim online, by mail or by fax to Health Equity. Next, provide proof of your Medicare Part B premium payment. You'll receive an $800 reimbursement by direct deposit or check, depending on how you submit your claim, once it's approved. We'll go over this process in more detail. There are some important things to remember regarding your Medicare reimbursement account. First, Medicare does not need to be your primary coverage in order to participate in an MRA. Second, any member on your contract with Medicare Part A and Part B can receive this benefit. You must submit a separate claim for each member receiving reimbursement. And finally, you can use the funds any way you like, they're not restricted to qualified medical expenses. As we mentioned earlier, there are several ways to submit a claim. You can submit a claim online at fepblue.org/MRA, on your phone via the Easy Receipts app, which is available for download on the App Store and Google Play, or by sending the claim by mail or by fax. If you aren't submitting your claim digitally, you can get a paper claim form at fepblue.org/MRA or by calling 1-888-706-2583. Keep in mind that some methods are faster at processing your claims than others, which may impact how quickly you get reimbursed. Digital claims are typically processed in a matter of days if we receive all your information, whereas paper claim forms will take longer. Let's talk a little more about how to create your Medicare reimbursement account online. First, visit fepblue.org/MRA to register. You'll need to provide a 4-digit ID code. This is a combination of the day you're born and the last 2 digits of your Social Security number. For example, if you were born on the 8th day of the month and the last 2 digits of your Social Security number were 12, your ID code would be 0812. After you've registered, you can log in, fill out an online claim form and upload your proof documents. We review most online claims within 2 business days and will reimburse you once everything is approved. You'll have to include required information within your claim to prove you've paid your premium. This includes the date of your premium payment, the Medicare Part B account holder's name, the name of your insurance carrier, which is us, the Blue Cross and Blue Shield Service Benefit Plan, the type of expense, which, in this case, is a Medicare Part B, premium payment and proof of payment documentation. How can you provide proof of payment? Some examples include a Social Security cost of living adjustment statement, a canceled check, a copy of your credit card statement, or a copy of your bank statement. If you send a canceled check, credit card statement, or copy of your bank statement, you must also submit a Medicare Part B premium payment bill that matches the amount paid on your statement or check. You can learn more about the Medicare reimbursement account at fepblue.org/MRA or by calling 1-888-706-2583. Now that we've talked about what Medicare is and its costs, let's talk about enrolling in Medicare. You're first eligible to enroll in Medicare 3 months before your 65th birthday and 3 months after your 65th birthday. This is called the initial enrollment period. If you've received Social Security benefits for at least 4 months prior to turning 65, the federal government will automatically enroll you in Original Medicare. You'll receive a welcome packet with your Medicare member ID card 3 months before your 65th birthday. Members in Puerto Rico or U.S. citizens living outside the U.S. will get Part A automatically, but will need to sign up for Part B. If you're not automatically enrolled, there are 3 ways to enroll: online at Medicare.gov, by phone at 1-800-772-1213, or in person at your local Social Security office. If you decide to wait to enroll in Medicare, you can follow the instructions in your Medicare welcome packet. If you want to enroll later, you'll typically have to wait until the general enrollment period, which runs January 1st to March 31st every year. You may pay a late enrollment penalty if you don't enroll in Medicare Part B when you're first eligible and you, and your spouse if applicable, are retired. Your Part B premium will increase 10% each year you choose to delay enrollment. Keep in mind, this penalty applies regardless of whether or not you keep your FEP or other FEHB plan coverage. This penalty does not apply to you if you delay your enrollment because you or your spouse is still actively working, and you're covered by a group health insurance plan like FEP. In this case, once you or your spouse retire, you'll have 8 months after retirement to enroll in Medicare Part B without penalty. Let's say you and your spouse are retired and delay enrolling in Medicare by 5 years. Since the late enrollment penalty increases 10% for every year you don't enroll in Medicare, that would result in a 50% increase in your premium, or an extra $82.45 you pay on top of the standard premium. As you can see, it's important to plan your Medicare enrollment ahead of time so you can avoid any unnecessary penalties. Of course, the choice to enroll in Medicare is always yours. However, if you and your spouse are both retired, we recommend you take Medicare Part B as soon as you're eligible. Next, we'll move on to how you use your combined benefits. Always remember to bring your FEP member ID card and your Medicare member ID card when receiving care. Showing both to your provider ensures we can process your claims correctly. Did you know Medicare has its own network of participating providers? These providers accept Medicare's assignment, or payment, but you still might need to pay a cost. However, when you combine your FEP and Medicare coverage, we'll pay the difference for covered services, meaning you'll pay nothing. If you have FEP Blue Focus or Basic option, you'll recall that you must see preferred, or in-network, providers who are also in the Medicare network. Standard option members can see providers outside either network. You're probably wondering what happens if a provider doesn't accept Medicare's payment. They can only charge you up to 115% of the Medicare approved amount. This is called the limiting charge. Let's take a look at what that'd look like. If a provider billed you $2,500 and Medicare has a $2,000 assignment for that cost, the most they could charge you is $2,300. Note that a provider who has opted out of Medicare is not subject to the limiting charge. We recommend asking your provider if they have opted out of Medicare. Also, be aware that a provider might ask you to sign a contract asking you to agree to bill you directly. We do not recommend you sign a contract like this. If you do, Medicare will not cover your service. Choosing your healthcare coverage when you're eligible for Medicare is an important decision. There are helpful resources that can help you navigate your options. We're here to help you at every step of the way. Visit fepblue.org/Medicare to discover information about combining your FEP coverage with Medicare. You can visit the official Medicare website at medicare.gov or call 1-800-MEDICARE to learn more about Medicare and its benefits. You can also visit your local Social Security office to help you with your enrollment needs. Find your local office at ssa.gov or by calling 1-800-772-1213. Once you retire, OPM becomes your payroll office. You can visit opm.gov to learn more about the FEHB and other federal benefits programs for federal government retirees and active employees. Thank you for listening to this presentation on Medicare and Blue. We hope you learned a lot. Be sure to follow us at FEP Blue to get important benefit updates, additional information on combining Medicare and Blue, and tips to live healthy.